So, Dr. Goldhammer, great to meet you. Thank you for agreeing to do an interview with me. So, for those of you who don't know who Dr. Goldhammer is, he runs the True North Health Clinic in Santa Rosa, California, the only clinic in the United States that offers medically supervised water fasting, if I'm correct.
Yeah, there's not a lot of us doing water-only fasting.
So that started 30 years ago?
It did, 1984. My wife, Dr. Morano, and I started the True North Health Center.
So what was the impetus for that, as in, like, what initially got your interest in fasting, and then, like, sort of the big steps of actually opening the clinic and all that?
Well, I got interested at about age 16 because my best friend, Dr. Doug Lyle, used to beat me in basketball. And I thought I was looking for an edge so I could beat him. I started reading. I came across some Herbert Shelton stuff. I read about fasting and a vegan diet. And I thought, you know, if I did all that, I bet it would give me an edge. And so I diligently adopted a vegan, SOS-free diet. And
what year was this?
This was when I was 16.
Okay. But so, I mean, I'm just curious. Back then, I'm sure pre-internet, like, this was hard to come. Information was difficult to come by.
Yeah, it wasn't. Information wasn't as easily disseminated back then. As it turned out, it completely failed because he adopted the same diet and he can still kick my butt to this day. So yeah, it was a complete failure in terms of the goal of beating Dr. Lyle at basketball, but it did get me very interested. And I met a gentleman named Dr. Bennett, who was a chiropractor, who did this kind of work with fasting and a vegan diet. And he told me that it was the best job in the whole world because the patients did all the work, the body did all the healing, and all the doctor had to do was take credit for the good results, and I thought that was the job for me. So I pursued chiropractic college at Western States. In Oregon, I went to osteopathic college in Australia, and in 1984 we came back and opened the True North Health Center, which we've been operating for the last 30 years.
So what was that like in the beginning? I mean,
well, at that time, you know, it was really right around the time that it was before the Wilk decision. So chiropractors, it was if a medical doctor accepted a referral from or made a referral to a chiropractor, he would be potentially losing his hospital privileges and concerned of unethical behavior for cavorting with unscientific cultists. I remember the local lab came to us and said, hey, why don't you guys do your lab work with us? And we agreed, and then it turned out they couldn't do it because the medical staff were so violently opposed to cooperating with chiropractors. The idea of fasting was considered a gross violation of the standard of medical practice. So, you know, the whole nature of the practice had to be kept relatively low-key. So we've never been in the phone book. We didn't advertise. We kept it very low-key. In fact, even to this day, 50% of our patients come from out of state, 15% are foreign. And we still see a relatively small pool of local patients because all of the talks that I've done are usually out of area just to avoid annoying the powers that be. Now, of course, times have changed, and, you know, integrative medicine, and, you know, we're getting national exposure through articles like appeared recently in GQ magazine, and now ABC Television's Nightline show is going to be doing a feature on this soon. So,
oh, when's that coming up?
They say in April. So one of the slots in April.
So you've obviously never had like a PR team or anything like that.
No,
it's all just sort of snowballed recently. I mean, this is.
Well, I think it's steady growth over the years. What happens is, it turns out when people that are sick get well, they tend to tell people that they know. And right now, most of our patients come from, we have about 30 doctors a year that train with us through internship programs. They get into practice, and then they'll send us their most motivated patients. So we have around 100 physicians out in the field that regularly refer people in for fasting supervision. And we have, you know, 10,000 people that have been through the program. So.
And you said everybody that's walked in has walked out?
So far, everybody that's walked in for fasting has been able to walk out, so we're trying to keep our unblemished record in terms of patient safety.
Now, I understand that there are, like, oftentimes contraindications where you don't want to fast certain patients. Can you?
Oh, absolutely. In other words, for example, there's many patients that you have to be able to get them stable off medications. Many medications would be contraindicated. People that are in a cachexic or depleted state may not be a good candidate for fasting. Patients that don't have enough education, so they're too fearful. Fear itself is a pretty powerful emotion, probably not a good thing to enter fasting with. So really, we limit our practice to the people that are going to have a really good result and make us look good.
Okay. And so, and I know that you talked about type 2 diabetes. You said you have something like an 80% success rate with fasting that condition. But I have a friend who's type 1 diabetic, and he says that nobody will medically supervise a fast for him.
Well, yeah, type 1 diabetics, of course, don't make insulin because, you know, their islets of Langerhans and the pancreas have been deactivated, possibly early age from exposure to dairy or some other thing that triggered immune response. So virus, there's other theories, but at this point they don't make insulin. Insulin is necessary in order to adapt the fasting process. So you generally wouldn't be doing water-only fasting in the true type 1 diabetic. We would approach it through more diet and lifestyle exercise and other types of management.
Okay. All right. So at age 16, you decided that this was something you're interested in. What made you choose chiropractic as opposed to, oh, and then later osteopathy, but as opposed to like traditional medical school or naturopathy or something like that?
At that time, and up till relatively recently, medical doctors or osteopaths for that matter really couldn't do fasting supervision because it was considered malpractice. It was just not an acceptable procedure. So knowing that the medical attitude towards it was so negative, that didn't really encourage me to pursue that. The chiropractors actually were interested in nutrition and in fasting, and I know in my training at Western States we had many nutrition and dietetic classes, including instruction in the use of fasting, so there was a much more open attitude, at least at that time, of the chiropractors. The naturopaths were interested, but they didn't have licensure at that time, and so it would have been very difficult to practice legally.
I think even still they only have 25 states or so.
So I think that it made sense to pursue chiropractic training because you would get the training that you needed as a foundation. The profession itself was open to the idea of actually getting sick people well, and there wasn't the strong pharmacological bias. So it certainly at that time made a lot of sense. Now, of course, in medicine you have integrative medicine, and so I think today it would be less of a problem. Say if somebody did pursue medicine or osteopathy, they probably could practice without it necessarily being as burdensome a problem.
Okay, that's interesting because that's pretty much the same, along the same lines that I made that choice to come to chiropractic school. So do you still practice spinal manipulation, adjusting?
I do. I see patients 5 days a week, outpatients and inpatients, and we use diversified manipulation, physical therapy, rehabilitation techniques. So these are all an active and integral part of our practice, both for our inpatients and our outpatients.